As Chief Marketing Officer, I have the privilege of telling our story and our unique value proposition across businesses and consumer audiences. In the context of Payvider, this notion of control, convergence, collaboration, a holistic approach to patient well-being and care that can be delivered through better value, through integrated care, resulting in superior experiences, lower costs and better outcomes. That's really the basis of every marketing plan I write. So when I think about our mission as the provider of high quality, affordable care and services to improve the health and members of our communities we serve, I just think we are squarely in this Payvider space. And I think a lot about technical interoperability, right? Being able to have the accessibility of data and flowing to these, end-to-end experiences. So, Deepa's talking about how do you have a holistic view, right? How do you deliver care holistically, regardless of where these relationships exist? And Kaiser Permanente has been built on our ability to do that, right? Have end-to-end experiences from expertise in prevention to helping you through your acute care, chronic conditions, home care. But so are our competitors, right? They're saying that they can do it too. So I think the opportunity is for us collectively in the industry to be, hyper-focused on the experiences that we provide, end-to-end experiences, the ability to, think about, the ability to have the visibility into the patient experience so that you can engage at those critical times of care, right? From either like I said, on the prevention side, all the way through the care and then the home care side. I think that's the opportunity as we think about the Payvider space. I feel like we've been a leader in digital transformation healthcare for quite some time, with being one of the first adopters of the electronic medical record, and then being able to schedule appointments, see your doctor, virtual care. But now, as you were just describing, there's all these point solutions, this proliferation of point solutions that could, look, as you string them together, can look very much like this integrated model that we are. So, I think it goes back to our ability to differentiate and describe the ease and convenience and the care and the outcomes that you could get as a Kaiser Permanente member. I think as a marketer, as the head of marketing, I think a lot about how to put ourselves against these verticals that are saying, we can do it better, we can do it faster, and really with the businesses we're trying to engage with, being able to stand and have these conversations that actually sets us apart from them. It's a really important part of the business, and it's quite a challenging time because it's such a, I think Deepa said, just how complex all of this is, right? For a consumer and for an employer to figure out, what's the right solution for me. And I think that we're at this really interesting paradigm shift in how we need to, balance the Payvider who can do it all against these vertical point solutions. Well, this is a space where I feel really fortunate, right? Having being an integrated care delivery system. So, what it means for us and how we think about the experiences we provide. We're able to have seamless care and administrative experiences, because of the integration of our data and our systems. I was thinking about Deepa. I was listening to you, thinking about just a few weeks ago. So I got the flu, even though I got the flu shot. I was able to schedule my appointment, get my meds, have my value summary, understand if I owed anything in my copay within, a few minutes, because of just the ability of our data to flow back and forth. And I think about that. So as a patient and a member and an employee, the value proposition is just it's so important because of the ease and the convenience and getting everything in one place and not having to overcome the barriers of a system talking to each other. So I feel really fortunate in that. And then I think the opportunity that's in front of us, all of us, is how to use AI, how to use automation to go faster, to be able to get to care outcomes faster, to be able to come to care plans faster, and to have the coordination that our patients I know rely on Kaiser Permanente for, but to have more access and understanding of the whole care team, working together across their continuum. too. And I love the fact that you're focusing on journeys because we're selling to employer groups, we're selling to consumers, and we have to deliver outstanding patient experiences. So we think and talk a lot about and build out these journeys with our customers, thinking about how do we deliver value? How do we make sure that our data and the outcomes we're delivering are transparent to them? So we're constantly delivering value to them and their employee base. So that's a really important opportunity that we continue to refine through the data that we have. On the consumer side, it's really about meeting the consumer where they are, and I think my colleagues here mentioned that as well, right? So if you're in a digital environment, if you prefer a physical environment, if you want something in between, how do you meet them where they are and lead them through the process if they're trying to join you to enroll with you to get their care and coverage, or if they want to get care with you. Being really thoughtful about all those places of interaction and all those opportunities of personalization, where we think about that deeply. And we're all consumers, and we have very high expectations, and we're in a really complex industry. So our ability to make things simple and personalized and contextually relevant, I think, is really the name of the game and where we are focused. Competition breeds innovation, and healthcare is completely unaffordable. So the more of us that are pushing each other to do better, I think we could together drive down costs of drugs. We can create more competition for how we innovate virtual care, how we can band together and drive better community and health outcomes, get better at health equity. There's just I think it's ripe with possibility when you have this competition emerging, and it's driving us all of us, I think, collectively to think differently and get more innovative on how we deliver care. So while it's on the business side, it's a scary proposition. I think it's when you think about our mission and what we are trying to bring to care, it's a good thing. Competition's good. Good. What we haven't talked about, I think underlying this is trust, and the trust that comes from the patients that we serve, the consumers that we serve, the employers that offer us to their employees, and our ability as a payvider to build that trust, right? With our model, with our ability to share data and be transparent and help deliver outcomes and value. And of course, if you do have a serious condition, that we're the place who can help you get well through diagnosis and all the way through care. So I think I just want to point out that the trust factor and the experience part of the conversation. It's a really interesting time to be in healthcare. I feel super privileged to be working here and be able to be the CMO of an organization like Kaiser Permanente because of our mission and what we stand for. And I think what you hear in between Mary, Deep, and I, we're very aligned in our goals and what we want, because at the end of the day, Mary said it so well, right? It's how we can care for more people, like how we can make sure it's transparent, it's easy to get the care you need in the way you want it, so that we can have better and more healthier outcomes for all the communities that we serve.